Hello everyone, Swezi here, back with another video. So today I'm still continuing the visa series. So I've been talking about different types of visas here in the UK. I've talked about the student visa, I've talked about the skilled worker visa, and today I want to talk about the health and care worker visa. So I normally get this question, Wezi, I'd like to come and work as a care assistant. I'd like to come and work as a support assistant. I'd like to come and work as a nursing assistant. What can I do, or what should I do? So the answer, as always, is you need to have the health and care worker visa. Now, today I want to talk about a few things to do with this visa. Now, as I talked about in the previous video to do with the skilled worker visa, the very same thing is also important in terms of this health and care worker visa. There is a need for you to get a job that will sponsor you, and they will give you a certificate of sponsorship, the COS. So you need the COS, because with the COS, what will happen is you'll be able to get the COS number that you will now use to apply for the visa. Because as I said, or as I always say to say, you can't start applying for the visa before you get the COS number, or if you're a student, before you get the CAS number. So you need to get this side sorted out before you start the visa application itself. So what I'll do today is I'll share my screen and just talk about a few things to do with the health and care worker visa. But let me just say, I worked as a health and care assistant when I was doing my master's in 2019 to 2020. But then I did not apply for this skilled worker visa. For this health and care worker visa. I was working as a health and care assistant under the student visa, because you're given an allowance to be able to work. So I know a little bit about the job itself because I've been able to do the work, and I've had chats with different people that have the health and care worker visa. So I thought I'd be able to share a few things. I'll be sharing my screen in a moment for you guys to see what I'll share. So, and then we'll take it from there. So, as you can see on my screen, I'm now showing you the UK government website. So we have the health and care worker visa. So click this one. Let's see what we have here. So it says a health and care worker visa allows medical professionals to come to or stay in the UK to do an eligible job with the NHS, an NHS supplier, or in adult social care. So let's look at the eligibility. So for you to qualify for the health and care worker visa, you must be a qualified doctor, nurse, health professional, or adult social care professional. Work in an eligible health and social care job. Work for a UK employer that has been approved by the Home Office. Have a certificate of sponsorship. So this is very important. As I said, you need to have an offer, and you need to be given the certificate of sponsorship for you to be able to apply for the visa. Then you should be paid the minimum salary. How much depends on the type of work that you do. So if you want to check whether your job is eligible, you can click here, check whether the job is eligible. Then it brings us here. So you must meet all the following requirements to be eligible for a health and care worker visa. You are a qualified doctor, nurse, we've talked about this. Your job is eligible, we've talked about this. You'll be working for a UK health and care sector employer that's been approved, we've talked about this. You're being paid a minimum salary rate or the going rate, we've talked about that. So check if your job is eligible. You can be able to check the 4-digit occupation code. You can click here to go search it out. But I think here is a summary of some of the codes for these jobs. So let me just give an example. As a physical scientist, this is a code for you. As a physiotherapist, this is your code. So you can go down just to see the codes, because these will be needed. If we also have social workers here, I think most of the people that contact me are social workers. So yeah, there's a code for you guys as well. So they're saying you must have a job offer from either NHS, an organization providing medical services to the NHS, or an organization providing adult social care. So this would be home care, home care agencies, or care homes rather. I wanted to say care homes, not home care. Yeah, care homes, right? So if you're a care worker or a senior care worker, your employer must be registered with the Care Quality Commission. If you're a care worker, code number this one, or senior care worker or senior care worker, this is a code number. I think you even be able to see it here. It wasn't here, but yeah, anyway, here they're talking about something here. Oh, sorry, the one that I was talking about above was social worker. This one is care worker. So different code numbers, right? So they're saying you usually need to be paid at least 2,300 pounds. Now, let me say this: I'm shooting this video on 30th of March 2025, but then in the following weeks, there's been news that this amount may change to 25,000 pounds. So, as I always say to say, these rules and regulations do change from time to time. At the moment that I'm shooting this video is 23,000 pounds, but likely in the next 2 weeks, I think from the 9th of April, if I'm not mistaken, it will move to 25,000 pounds. So always check these amounts before you apply for these jobs. So if you're able to see the job for the skilled worker visa, they were talking about 38,000 or somehow 30,000, but for this one, they're talking about 23,200. All right. So you can be able to go down to see a few things here. So let's go back and to here. So we've talked about the job itself. We've talked about the salary. Now you also need to prove that you're able to speak English. So these are the ways that you can be able to prove that you're able to speak English. If you're from these countries, you don't need to prove, but for the rest, you need to prove that you're able to speak English. So how much does it cost? So when you apply for a health and care worker visa, you need to have enough money to firstly to pay the application fee, also to support yourself when you arrive in the UK. You usually need to have at least 1,270 available, unless you're exempt. So the exemption comes when your employer says they'll be able to maintain you when you come. So you're given an option when you're applying for the visa to say, will your employer maintain you when you come? When you say yes, it means you don't have to prove. But if the employer said no, it means you have to prove with this amount in your bank balance, in your bank account for the last 28 days by the time you're applying for the visa. So you'll be told how much you need to pay when you apply. But these are the application fees. The standard application fee depends on whether you be in UK for up to 3 years, that's £284, or more than 3 years, that's £551. So there's no difference whether you're applying, you're in the UK or you're outside the UK, the amount is still the same. So I think we've already talked about the money to support. If your employer is supporting you, you don't need this, but if not, then you need to have this money. I've talked about it. It has to be in account for at least 28 days in a row, right? So the rest is if your employer is supporting you, I've talked about this, it means you don't have to have that money, right? So let's go to the next thing, the documents that you need to apply for this. So you need your certificate of sponsorship, reference number. We've talked about this already. You will need proof of English. We've talked about this. As obvious, you need a valid passport. You need the job title and annual salary, your job occupation code. We've talked about it. The name of your employer and the sponsor license number. We've talked about this as well. Other documents that you may need is to do with the maintenance money that I talked about. If you're coming with your dependents, this is where you have to show the proof. You also need to show the TB test results. So the test results, or the certificate is valid for 6 months, so you can do within that period a criminal record certificate if you're working in certain jobs. And yeah, pretty much that's it. So let's look on the health on your partner. and children in terms of dependence. So this is another important part. Let's see what they say. Your partner and children can apply to join you or stay in the UK as your dependents if they are eligible. If your partner or child's application is successful, their visa will usually end on the same date as yours. If a child's parents have visas with different expiry dates, the child's visa will end on the earlier date. A dependent partner or child is any of the following. So, talking about your husband, your wife, civil partner, or unmarried partner, your child under 18, a child over 18 if they currently have permission, leave to enter, or leave to remain to be in the UK as your dependent. You will need to provide evidence for this. So let's look at this. They're saying if you are a care worker or senior care worker, your partner and children cannot apply to join you or stay in the UK as your dependents unless you are employed as a care worker or senior care worker in the UK on a health and care worker visa before March 11, 2024. Now, hear this. As I say, these rules and regulations do change from time to time. So if you're coming to work as a care worker, if you apply for a job now, know that the chances of you coming with your dependents are close to zero, right? As said by the UK government itself. Now, things do change, likely maybe it can change again in the future. But as of March 11, 2024, if you're working as a care worker or a senior care worker, you cannot come with your dependents. So going down the same what and one of the following, for example, let me just continue to read. You're currently still on a health and care worker visa, you're extending your health care worker visa, or you're changing to a new job. So just be sure when you're applying for this visa, or actually when you're applying for jobs like this, because otherwise you may separate yourself from your family. So you just have to be sure. So your partner, they're saying you must be able to prove one of the following: you're in a civil partnership or marriage that's recognized in the UK. You have been living together in a relationship for at least 2 years when you apply. You have been in a relationship for at least 2 years when you apply, but you cannot live together. For example, because you are working or studying in different places, or it's not accepted in your culture. So just different things for different people. So yeah, I think you can read the rest for your children and the money that you need to support them. So that's if you're coming with them, but if not, then it's just you alone who's coming. So you just have to be careful what you're applying for, right? If you're applying outside the UK, I think we talked about the fees already, and um, what else? You normally get a decision within 3 weeks, but you can also get it faster by paying an extra fee. Um, so yeah, I think for the rest you're gonna be able to read. I thought I'd just highlight a few things here, and yeah, let's see if I've missed anything else here. Extending your visa, updating your visa, switching your visa, or taking additional work. Let's see what they say. So when you come to work in this under this visa, they're saying you can do additional paid work on a health and care worker visa as long as you are still doing the job you are being sponsored for. You can also do unpaid voluntary work. Yeah, guys, so that's it. I thought I'd just highlight a few things to do with the health and care worker visa, and I hope you do find this video helpful. If you do, you may want to share this with your friend, your colleague, your acquaintance, and anyone who you think can benefit from this video. I'll see you guys in the next video. Peace.